My philosophy of work as a dual board certified plastic surgeon who has been practicing for more than a decade. The philosophy is to make the face look as good as possible without any telltale signs of surgery, or as minimal as we can get. For that, I do a more comprehensive approach to facial rejuvenation. I am always looking for ways that I can improve that face to bring it back to where it used to be 10 years ago, 15 years ago. That usually involves some sort of changing shape, either the brow, the eyelid, the face and neck. More or less volumization, so replacing volume that used to be that is not really filling it up, it's just replacing volume, and also lifting. We do that with the most updated techniques that do give natural looking results long term, and minimizing as much as possible any scars, both visible scars or the amount of scars. So that is my philosophy, and for that reason I usually do rarely isolated procedures, because we just don't age just in one way. There is always shape change, volume loss, and a little bit of droopiness or laxity. That's why combination of procedures make people look better after surgery than just simple isolated procedures. And that's when I'm looking at someone, I'm always looking at the face as a whole. I'm not just looking the eyelids or the lower eyelids or the face and neck. I'm looking at everything, including the skin health, including the skin quality. Because when we are able to improve all the areas together, that's when we get the most beautiful and natural results.